I'll leave you with the Dr. Weiss.
Thank you.
So, thank you, Josette, for your nice introduction. I voted for her. I had a task, you know, she wrote me. What should I say? Well, what are you? And so I said, well. So, the first thing I would like to torture you with my lecture, which is about 14 minutes long. And then at the end of the time, we will have a film. I have brought a DVD with a film which is about 25 minutes, so you can also see some action. I would like to present to you the best practice program in its environment, with history, with indications, with paradigms used for physical therapy, with evidence, patient advice, education, methodology, and treatment options. But first of all, I would like to present you my personal credo, because children and adolescents with idiopathic scoliosis and also with other kinds of scoliosis sacrifice their quality of life for treatment, sometimes for many years. Therefore, we should accept it as our task to offer only approaches with best possible effectivity, best possible quality. So you're late, Tommy. Shortest possible time of treatment. Best possible comfort is also very important. Best possible service, and of course, the least side effects. The history of the Scoliotic Best Practice Program clearly is Katharina Schroth, my grandmother, and the further developments my mother made. You know, we had, my grandmother had curves exceeding 90 degrees, and these were all 3 curve pattern like this, you know. The other curves would not be detected. But by the time bikinis came up, and suddenly my mother said in the 70s, oops, there's another thing, you know, we can't treat with that. So the 4th curve of the smallest possible classification is based on my mother's work. 4 curve and 3 curve. So we came from, not me, I was not alive at that time, so, but the history, we came from 3 to 6 months of rehabilitation times. Here's my grandmother with curvatures like this. In the 70s, it was 4 to 6 weeks, and this is my mother in action. And this program of 6 weeks has been studied in a prospective controlled trial. These were patient samples from 89 really, yeah, to 91. So, my aim is to reduce unnecessary stress and negative impact of treatment as far as possible. Make braces smaller, as can be seen in the 19 standard. This is a picture from my friend Dr. Rigo here in Barcelona. And right now, a brace for the same kind of curve pattern would be much smaller. But also, this applies for physical therapy approaches. So when I was still in charge in the aesthetics clinic, I published a paper showing that with 2 weeks of treatment, you could reach the same effects than with a 4-week treatment. Now we are at twice 90 minutes, so patients come in for having a brace from New Zealand, from Russia, from wherever, and we do not have such an inpatient treatment anymore. And they have 2 90-minute sessions, and they know what they can do at home. And the brace also is ready after 2 days. And they can go home after adjustments of 5 days, so we don't have so much time anymore. The overall treatment regime still is observation,